Welcome to Presenteeism, Psychological Health and Workplace Performance During the Pandemic. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness Institute, and I'll be co-moderating today's webinar. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWI. We thank our program partners, Education Advisory Committee, and speakers who contribute to this webinar series. We would also like to thank our academic team and our 9 founding partner organizations in the Harnessing Talent project, including the Canadian Mental Health Association, CMHA, represented by Jordan Friesen, who is with us today. Harnessing Talent, Alliance for Recruiting and Retaining Canadians with Disabilities and Mental Health Challenges, is a 3-year project funded by Employment and Social Development Canada. If you would like to learn more, please visit our website at harnessingtalentalliance.ca. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing, any comments you may have, and any questions related to the webinar. We will collect questions submitted throughout the webinar and follow it with a Q&A based on the questions submitted. Please note that the Work Wellness Institute is recognized by the Society for Human Resource Management, SHRM, to offer Professional Development Credits, PDCs. This program is valid for 1 PDC for the SHRM CP or SHRM SCP. Our institute also offers accreditation recognized by the Vocational Rehabilitation Association, VRA Canada. If you are a WWI member or a VRA Canada member, you receive free certificate of attendance. Otherwise, there is a $15 administration fee. We are very excited to welcome Dr. Caroline Biron, our speaker, and Jordan Friesen. Today's webinar will be co-moderated by Jordan, National Director of Workplace Mental Health at the Canadian Mental Health Association. His experience in a wide variety of roles, including clinical service delivery, case management, education, and nonprofit leadership, provides him with a solid understanding of the industry and in-depth knowledge of where gaps exist for innovation and collaboration. It's our greatest pleasure to have you both with us online. Jordan, I will hand it over to you to introduce Caroline.
Wonderful. Thank you so much, Yusra. Caroline, very nice to see you. Very nice to meet you for the first time today. I'm excited to be talking about presenteeism today, and in particular to hear a little bit more about what you've learned about the state of presenteeism and psychological health during this pandemic that we are all living through. I know that the issue of presenteeism is one that I often talk about with employers on a regular basis, and I know it's a growing concern, certainly from an economic perspective, certainly before this pandemic, and I think now certainly in the context of the pandemic, I am certainly a victim of presenteeism to some degree myself. I'm sure many of our audience today have experienced something similar. So I don't want to take up too much time with my opening thoughts. All that is to say that I'm excited to hear what you've learned. I'm excited to hear more about the state of presenteeism in the context of our pandemic, and grateful for the research that you've done. So with that, I will turn it over to you, Caroline. But first, let me introduce you. So for those of you that don't know Caroline, Caroline Biron is a full professor in the Department of Management of the Faculty of Business Administration at Laval University. She's the director of the Center of Expertise in Occupational Health and Safety Management and a member of the VITAM Sustainable Health Research Center. Her work on presenteeism, preventative interventions in psychological health and stress in the workplace has been the subject of numerous scientific and professional publications. So we are pleased and thrilled to have her with us today. And with that, Caroline, I will let you take it away from here.
Thank you, Jordan, and thank you, Yusra, and thanks to the Institute for the invitation. Thank you, everyone, for being here today. Just want to say a little quick word about the Center of Expertise in Occupational Health and Safety Management. Some of you might already know our little research group. We used to be a research chair, and now The chair was founded by my colleague Jean-Pierre Brun in the year 2000, and as many of the rules have changed, we've changed our name, but haven't changed our mission, which is to develop knowledge that promotes prevention in organizational health and occupational health and safety, and also support organizations and individuals with these dimensions of their work environment. So we have a website which is the same as before, cgsst.com. Most of it is in French at the moment, but we will be building up slowly an English website with all the tools that are freely available. And I'd like to thank our partner, La Capitale, without whom our activities would not be as possible. So now I'm going to talk to you about a research today that was conducted with my team. So it's a project that's funded by SHIRT, the Social Sciences and Humanities Research Council of Canada, my co-researcher, Claude Fernet at Trois-Rivières, and my collaborator in the United Kingdom, Maria Karanika Murray, and my very precious statistician, Hans Ivers. This is a research that's been done in partnership with SOM, so a private firm, SOM, for the data collection. So I want to thank all the participants for their collaboration. And so the webinar was done in French also. It will be available on YouTube in collaboration with Empreinte Humaine and the Institute. Now, because I always talk too much, and because I know in webinars some people leave before the end, I'm going to start with my conclusions, so that'll take the pressure off. And my first conclusion is that to treat psychological distress, we must not only treat the individual, we must also treat the company and take care of work and work organization. This is a conclusion that I've been pretty much saying for the past 20 years, ever since I've been involved in this field. And yet I still meet with employers who think that psychological distress problems are something that relies on the individual's shoulders, you know, something to take care of yourself. If you know you're stressed, if you have a stressful job, go for a jog, it'll help you, do some meditation. And we're arguing that yes, it is the individual's responsibility, but there's also something at the organizational level, and we'll go into depth with this idea in mind. My second conclusion is that we need to create sustainable quality jobs. And during the pandemic now, more than ever, don't wait until later. I think psychological health is an issue that we're very likely to, I think it's going to be like all these green issues, becoming green. I think there's perhaps a chance that we're going to be postponing this until later, and we shouldn't, because to me it's part of the solution for a better work organization, better health, and better productivity for the whole society. And this is a shared responsibility between individuals, groups, leaders, and organizations. So it does the IGLO model that I owe to my colleague Karina Nielsen. So the objectives of the presentation today, we'll be looking at what's happening during lockdown in Quebec. So this is data from Quebec. What's happening at work performance during lockdown. We're going to talk about presenteeism and what's happening during lockdown as well, and try to identify avenues for intervention. Now, during the pandemic, we hear about this corona coaster, the ups and downs of your mood during the pandemic. So 1 minute you kind of like confinement, you're baking your own bread and you're, I don't know, building a little house for your children in the backyard. And the second minute you're crying with anxiety related to the crisis, related to deconfinement. And there's been many studies all over Canada showing deteriorating mental health across the whole society. And a new reality for many is teleworking, so working from home, which is my situation. I'm also a mommy of two, 4 and 6 years old. So if you hear any noise in the background, this is my reality as well. And this questions presenteeism, what's happening with presenteeism during the lockdown. So we're going to go into that. First, I'm going to start by looking at schools of thoughts to define presenteeism. Now, there's the European school, which defines presenteeism as the behavior of working while ill. And this is the definition I will adopt throughout this presentation. So working while you're ill. And therefore, we focus our attention on what's motivating this decision process. Like, why do you work from home? Why do you work while ill? I mean, So that's the European school. The second school is the North American school, the act of working while ill through its consequences on productivity. And it's a little bit controversial because you might not necessarily have these consequences. You might be able to work through illness without too much impact on your performance. Or perhaps this is something that needs to be taken into account as to how much your productivity is impacted depending on the severity of the health problem. So there's been some controversies about the North American school. Same with the third school, which is non-work related presenteeism. So this expands the concept of presenteeism, and it includes non-health related productivity losses. So this is the example of someone who would go to work and do some personal activities. So you're doing your own shopping, you're on social medias, you're on Facebook, and you're sort of procrastinating at work. This is also a concept that is quite controversial because you don't know, why is the person on social medias instead of working? Why is this person doing some other things at work? And perhaps it's deviance, perhaps it's boredom, perhaps it's disengagement, and then this would call on a very different range of theories to explain that, and it's not necessarily presenteeism per se. So this one definition has not been used that much because we don't really know anything goes here to explain why a person would not be doing their job. So we're going to be mainly using the European school, so the behavior of working while ill. Now, okay, here's the prevalence in Quebec, in the Quebec labor force in 2008. This is the last data we have of a survey that was representative of the Quebec working population, active population. So working while ill, short-term presenteeism. So that is people working between 1 and 9 days a year while ill. So short-term presenteeism, 40% of the Quebec workers, whereas doing 10 days or more during the last year of presenteeism, we had nearly 15%. So we're going to be looking at these statistics as over the past 7 days during lockdown. Now, in terms of causes of presenteeism, these causes can be quite, there's a wide range of causes. So there's the rather environmental, something quite broad, the economics, politics, so and also at the organizational level. So for example, the absenteeism policies will have a strong impact on whether you show up at work while ill. So if you have a strict absenteeism policy, if you have somebody calling you at home saying, how come you're not at work, and you have very strict policies, you'll tend to show up more despite your illness. Labor shortages, so this is something that's been quite all over the news during the crisis, where people with they were still ill with COVID-19 and they had to go back to work after 7 or 8 days because of labor shortages, especially in elderly care centers. So this is one factor that can certainly explain why people would show up at work ill. Job insecurity, so afraid to lose your job. Work-related factors such as having too much work to do, simply just too much work to do, and you think, I'll just work. It doesn't matter whether I have a cold or whatever your health problem, you think I'll just get rid of my workload. It's impossible to get a replacement. Perhaps there's a lack of support from a supervisor, and someone would be afraid of negative repercussions. We know that having clients or patients or employees or students, anyone who rely on you to do your job, this will tend to increase presenteeism because you don't want to be letting these people down. Also, the fear of letting colleagues down is a factor that will impact presenteeism, and the team culture. So if you're in a team where everyone shows up through, despite their illness, then you'll tend to do the same because this is what's accepted. This is what's legitimate. It's a legitimate culture of presenteeism. The manager will also have a strong impact. If the manager shows up at work despite the state of illness, then this will influence the rest of the team. Now, of course, there's also individuals' characteristics such as work over commitment, for example, workaholics. financial difficulties, so for people who are paid only when they show up at work, lifestyle, work ethics. I had a PhD student, Muna, who did her PhD on presenteeism in small, medium enterprises. Muna Kneni, her name is, and her results were quite interesting. People were actually showing up at work despite their level of illness because they were feeling like this was a big family. So you go to work because it's a big family. I don't want to leave my colleagues down, and everybody had a really strong work ethic, and they didn't want to show, they didn't want to take sick leave. To them, in order to take a sick leave, you had to have something that was really, really severe. You know, it needs to be bleeding almost for you to take a day off. So, and this perhaps questions what are the consequences of presenteeism on health, and what are the costs of presenteeism. Now, there's been quite a few studies suggesting that the costs of presenteeism are higher than costs of absenteeism. And the reason for that is that there are a lot of these that are hidden costs. With absenteeism, you can see your costs in terms of short-term and long-term. But with presenteeism, there's a lot of stuff that's hidden, such as decrease in the quality, a higher number of accidents. So for example, workers with depression would have perhaps cognitive impairments. And now if you're working with machinery, for example, with cognitive impairments, it's easy to think that this could be an issue, and it could certainly play on the number of accidents. There's been suggestions also from studies that it would increase emotional exhaustion and exhaustion in general. So it's like using your car, even though you know your car needs to be taken to the garage because there's something broken, but you postpone doing that and you continue using it, but it's likely that it's going to cause some further costs. So also customer dissatisfaction. So if you're doing mistakes, if there are a decrease in quality in your job, then perhaps customers will be dissatisfied, colleagues will be frustrated. Health, also for your own health, there are suggestions that it could increase coronary heart diseases, especially in men. So there was a big study by Kivimaki in 2005 showing that it was a huge database of civil servants in the UK. I think it was 17,000 men, and they looked at men who they knew had a sickness issue of some sort through their administrative data, but they also knew these men didn't take any leave over many, many years. And then they showed there was an increase of 2.5, the risk of having a coronary heart disease. So I don't know about female, the study has not been done, but there are suggestions that it could be bad for your health. And there could be therefore an increased risk of absenteeism within the next 2 years. So in conclusion for this slide is that present and sick today means that you'll be exhausted, even more sick, and perhaps higher risk of being absent in the long run. However, despite these studies showing that presenteeism would be bad for health, my colleagues and I are arguing that perhaps there are situations where presenteeism would be healthy for your health, and we're basing this argument on the fact that so many studies have shown in the past that work is good for your health. It's sort of the backbone of your identity, and it's bad working conditions that can be harmful to your health, because work itself, we know from studies that people who are employed are in a better health than people who are unemployed. And so we're questioning, what is it with presenteeism then? Could it be sometimes positive for our health? There are several good positive reasons for presenteeism. For example, we know that it can support a gradual return to work, and gradual return to work, progressive return to work is something that is positive, and that can be that can lead to a more sustainable return to work, especially after a mental health absence. So perhaps this is a good motive for presenteeism. A colleague of mine, Louise Saint-Arnaud, did a study a few years ago, and she asked people who were absent for mental health reasons, she asked, how do you feel now? Do you feel that you're fully recovered or only partially recovered? And she had something like 44% of the sample who said they were not fully recovered, and yet they were back at work. And now you need to think, is this necessarily bad? If you have a mental health problem and you're at home and you just stay in the dark and you wait for it to go away, this is perhaps unlikely to happen. This is why doctors, the GPs won't prescribe a really long absence from work. They'll go one bit by little bit, like 2 weeks here, and then we see, because being absent from work for a long time is definitely not something that's good for health. Perhaps it can also be a reason for having a certain sense of accomplishment, performance-related self-esteem. Think about a day where before the COVID-19 pandemic, you just have a little cold, okay, just a little cold. And you wake up, you're just down under the weather this morning, and you think, right, okay, I'm going to take it off. And you spend the whole day on your couch watching TV. It's likely that at the end of the day, at first it seemed like a really good idea, spending the day in your pajama, but by 5 o'clock, you probably feel like a zombie. And as opposed to, you get up in the morning, have a shower, go for a little walk, and then try to do a little bit of work, and perhaps take a nap, take a little break, take many short breaks. And it's likely that at the end of that day, you'll sort of feel better and perhaps even not so sick. Of course, there's the risk of contamination if you show up at work while you're sick. This is a different issue, but certainly it could be a positive reason in terms of self-esteem. It could also help reducing the burden on your colleagues if you have to be absent from work. Could be reducing economic deprivation due to long-term absences. So, for example, if you're uninsured, self-employed, contract workers. Could reduce also the anxiety of losing control over workload. We all know that when you leave for your holiday, you have a big rush at work before the holidays and after the holidays. So this is a reason sometimes that you might think, okay, even though I'm sick, I'm going to do a little bit nevertheless. And now, is this good or bad for your health? Well, we don't know. We don't know this because there's been no research on the positive aspects of presenteeism. It could be also that you want to avoid a difficult situation at home, and work becomes like a refuge for you. So all these reasons are positive motives for presenteeism, and they've just not been explored in the previous literature. So what we're suggesting is that presenteeism is, yes, the behavior of working through illness, and we choose this definition because the other two definitions, the North American and the non-work related presenteeism, had some controversies around them. So we chose this definition, but we suggest that it's an attempt to balance your health and the performance requirement of your job. And research to date, it has failed to consider that in certain contexts, presenteeism could be perhaps something positive, depending on the work context. So far, presenteeism research has looked at everybody declaring a certain number of days per year or over the past 3 months while they were working through illness. So regardless of the degree of the health problem, the severity of the health problem, and regardless of the impairment in terms of performance. So we're considering a different approach, and we're suggesting that we should look at the severity of the health impairment and the performance impairment. And this will allow us to untangle the different types of presenteeism depending on the configurations of health and performance. So this is something we published, Maria and I, in Human Relation in 2019. Now, this brings us to a typology of presenteeism, where on the y-axis you have health and on the x-axis you have work performance. And if we're just going to portray that on a scale of 0 to 100%, well, if you have 0% of health, you're probably very, very sick and you're not in the typology because you're absent from work. This is where the severity of the health problem would make it legitimate for you to be sick and therefore absent. At the opposite hand, if you're 100% healthy, then you're not in the typology of presenteeism because you're healthy and you're present, and this is where we would want everybody to be, although it might not be, it might be a little bit unrealistic. And then on the other axis, work performance, then if we have 100% performance and you have quite a good level of health, a good degree of health, you would be in what we call functional presenteeism. Now, we have a study that's under the process of being published, but we were showing that functional presenteeism compared to dysfunctional presenteeism, while the working conditions were very, very different, very contrasted. So functional presenteeism had a much less stressful work environment. They were exposed to much less stressors, such as they had better job control, they had a lower workload, less job insecurity, better relationships with their colleagues, with their superior. So good working condition would seem to promote functional presenteeism. And the current project is that we want to validate this with a bigger sample. So dysfunctional presenteeism would be where you have rather strong or severe problems with your health and your performance is quite affected as well. In the overachieving presenteeism, you'd have perhaps people who maintain a certain level of productivity, but they do this at the expense of their own health. Therapeutic presenteeism, we think this is a box where you'd have perhaps caregivers. So you're taking care of maybe a sick child or aging parents, and you show up at work because it feels good, because it's a good place to be, and it takes you away from your problems at home. So therefore, yes, there's a certain impairment in terms of your health, and there's possibly a big impairment in terms of your work performance. And we think this typology might lead us to new avenues in terms of research, new avenues in terms of intervention. If you I'll do the parallel with psychiatry, where everything in the past used to be under the category called neurosis, and they put everything in that bag. Every mental problem would be underneath the neurosis umbrella. And I think it was DSM-3, or was it 4? DSM-3, I think, they started disentangling these things, and they therefore had the generalized anxiety disorder, the phobias, and then this brings some different interventions, more specific intervention kit to act on these problems. And we hope that this research will lead to more specific interventions depending on the type of presenteeism. So we could think, for example, that someone doing therapeutic presenteeism might have different needs than someone doing overachieving presenteeism, and therefore the manager and the colleagues could have a different approach to presenteeism. This is because there's been no guidelines so far with presenteeism. We all know that it's a problem, that it's costly, but nobody says, what should we do about it? And we're hoping this research will lead to that. I'm now going to talk about more specifically the situation in Quebec during confinement. The methodology is we collected data right between lockdown measures. So in Quebec, between April 30 and May 7th, we were still pretty much in lockdown. A lockdown measure require still full on. So we asked people to complete the questionnaire only if they had worked over the past 7 days. So this is a sample of workers over the 7 days before the survey was sent. So it's a web panel. It's representative of the Quebec population who were at work in terms of gender, age, and schooling. So 1,259 respondents. In terms of the sample characteristics, so we have a good distribution among men and women. In terms of age groups as well, mostly between age 25 to 64. I assume if you're between 20 and 24, you have something different, way better than completing a research questionnaire to do during lockdown. In terms of education, so again, a good distribution between high school, college, and university. In terms of work sector, so we got the public administration, private sector, the healthcare sector, and social welfare. Emergency services, other services that were open to the public, so essential services such as grocery stores, drug stores, and that kind of thing that were open to the public at that time. And we have about 22% of the sample that were in other job category, other sectors. In terms of job categories, so we have line managers, professionals, line managers and middle or senior managers, so 2 levels of management. professional, administrative staff, technicians, trade, and others. We asked the question how they spent their time working, and what we have over the last 7 days before the survey was half of the time spent teleworking as opposed to working in the workplace. So about half and half, whereas during normal times or before the pandemic, this would have been more like 5 hours of telework with 33 hours in the workplace. If you look at the total, so we work in average 2 hours less than we would in normal times, which is understandable considering that many of us are working with children and working from home. So 2 hours less, and we had 38% who were doing a ratio of 80%, at least 80% in teleworking and full-time. So 38% fully teleworking and full-time. I'm now going to look at what psychological distress is, and I'm going to explain what the indicator is. This is from my colleagues who were kind enough to give me those 2 slides, colleagues at the Institut National de Santé Publique du Québec. So we used the Kessler 6 questions, and we asked, in a past month, how often have you felt nervous, hopeless, worthless, so depressed that nothing could cheer you up, everything was an effort, restless, or fidgety? And you answer this on the scale of 0 to 4, and it'll give you a score between 0 and 24. And this will give you your level of psychological distress. Now, you can complete that and see if it's above 7, then it would be considered as high psychological distress, which means you need to be vigilant, you need to be aware there's something going on. So above 7 would be perhaps to your mental health saying that you're sort of feverish, okay? The same, if you were to be feverish mentally, that's kind of what it says. If it's above 13, then there's a good possibility that there's something more serious, that you probably would need some sort of treatment. Above 13 is something more worrying. Above 7, a score above 7 is a threshold that's recognized in the literature for its ability to predict the probability of developing something more serious. And it corresponds to the value that was used in 2008 in the Quebec Population Health Survey. And that's what was used in 2014-15. As a threshold. So I'm going to use the same threshold as the Quebec Population Health Survey and with my sample. So we're using this threshold of 7, okay? So a score above 7. What we have in this sample is quite a strong or a marked increase compared to the previous 2014 and 15 levels. So both for male and female, male went from 24% of high psychological distress to 41 in the current sample, and female went from 33% reporting high levels of psychological distress to nearly 56% in the current sample, with an average of 48% in my sample, 48% of male and female. In terms of employment, by employment sector, we also have quite worrying levels in terms of the sector health and social services. Healthcare workers, 61% of them report a high level of psychological distress. I think here this slide tells us pretty much everyone is affected, whether you're in this essential services, in public administration, perhaps a little less in private, but well, health and social services, definitely something here that's been worrying, and that's something that's been decried and mentioned by several people and researchers for several years now in Quebec. In terms of sleep problems, we asked various problems. Sleep problems was something that was particularly shocking. 75% of workers said they had some level of intensity of problems, 39% saying weak intensity, moderate intensity, 25%, 11% high intensity. Now, there's a really strong correlation between the intensity of your sleep problems and psychological distress. 84% of people with a high intensity of sleep problems are also reporting high psychological distress. So you're not sleeping well, you're in distress, and because you're in distress, you're not sleeping well. This is probably a circular situation here. In terms of work performance, we ask people on a scale of 1 to 10, so 10 being your best performance possible. So we asked them over the past week how they perceive their work performance. We have 30% people saying they were not too performant. They had only a performance of 7 out of 10 or less. On the opposite side, we had 43% reporting a rather good performance, 9 or 10 out of 10. And again, a really strong correlation with the psychological distress. So here you see that if your performance is rather poor, you have 65% reporting a high level of psychological distress. Whereas if your performance is rather good, then it's 34%. So this is a very strong association between these two phenomena. I think also this says, in terms of we're going through a rough economic patch, and it's difficult in many work sectors. And this is one for my conclusion number 2, where I was saying, do it now, act now, because it's not only just a question of individuals who need to take better care of themselves, it's also highly associated with our organization's productivity, and it will have an impact on our economy if we start taking care of mental health. Now, presenteeism, we looked at the health axis, right? We looked at psychological health and distress, and we looked at performance. So we looked at our 2 axes in our typology. Now we're going to look at presenteeism, because these are the 2 axes. Now, we did ask people, how many days did you work while ill over the past 7 days, which is the the European school of presenteeism. So how many days have you been working while ill? And what we have is 63% who reported 0 days, 0 number of days, and 14% who reported between 1 and 3 days, 23% who reported between 4 and 7 days. So nearly 40% of people have done some presenteeism, which is very comparable to what we had in terms of prevalence in 2008, except that this was over the past 7 days, whereas the 2008 survey with the Quebec working population was over the whole year. So this is probably quite a high number of presenteeism, high prevalence. We ask whether people do, whether there's a difference between people who are at work, physically present at work, as opposed to teleworking, and we found no difference. So you can actually do some presenteeism even though you're sick and teleworking. So this is something that I don't think has been looked at much in the literature, but yes, you can do presenteeism and do some teleworking. Now, if we look at the typology of presenteeism, what we find is there's 32% of the Quebec workers in my sample who reported functional presenteeism. So they're quite performant and they're in a rather good health, even though they're not fully healthy, and they're declaring presenteeism. So in other words, this is my 37%, okay? I look at the 37% who've been reporting presenteeism, and I'm breaking them down according to the type of presenteeism they're doing. So 32 are doing functional, 30 are doing dysfunctional, and we got 22 and 16 in therapeutic and overachieving presenteeism. And we're going to be following these participants over time. We're going to follow the evolution. My hypothesis is that good working conditions will influence what type of presenteeism you're doing here. I think there's something perhaps individual that has to be done, like you need to be aware of where you're positioned in this typology. Like if you're, for example, teleworking with kids, with full performance, and you've got your good physical and mental health, and you've managed to keep your house healthy and get rid of all your laundry and do everything perfectly, like are you in the overachieving? Like is your health affected, or are you really healthy? And therefore you're probably functional. So perhaps individually there's a reflection to have as to where we're positioning ourselves in here, and being aware of when it's time to perhaps take a sick day, as opposed to, no, I'm still functional. So individually there's a reflection to have, and organizationally we need to look at what are the working conditions influencing these types. And this is what we'll be doing over the next few months. We'll have 3 more waves of this survey, and we want to look at how people will be moving through the quadrants and establish some trajectories. Now, whose responsibility is it? I'm coming back to this IGLO model from Nielsen. The mental health and this balance between the productivity logic and the mental health that we're trying to preserve is definitely something that's at first and foremost individual, but there's also groups and leaders and organizations in terms of governance. So I'm going to say a few words about each. What senior management can do. I'm going to talk about psychosocial safety climate. Now, psychosocial safety climate is what my colleague Maureen Dollard in Australia came up with, is the causes of stress at work. It goes beyond psychosocial risk factors. It's the idea of shared perceptions regarding what we have in our organization to take care of our mental health. So what policies do we have, practices, procedures to protect psychological health and safety of workers? It values performance and health equally. More specifically, psychosocial safety climate implies 4 factors. It means management is committed, so we act quickly to correct problems and situations that affect the psychological health of staff. It means it's a priority in our organization, so there's equal importance that's given to both productivity and mental health, equally important. It means that we're communicating about these issues. Perhaps my supervisor will talk to me on a regular basis about these issues, about mental health, about stress, and it's not a taboo in our organization. It also means participation. So in my organization, stress prevention involves all levels of the hierarchy. Now, just for the sake of this discussion, I'm going to call them caring organizations. When the psychosocial safety climate is strong or high, I'm going to say it's a caring organization. And what we have with psychological distress and performance is a very, very strong relationship between caring organizations and psychological distress. What we have here is that it's a decrease of 24% in the proportion of people who report high levels of psychological distress. So when you perceive your organization as caring, there's a lot less people declaring themselves with high psychological distress. 24%. To me, that's probably the most striking result that we found in this study. So really strong impact when my organization is taking care of me and of my workers, my co-workers. Also an impact on performance. So we look at high performing workers, which are people who declare 9 or 10 out of 10 on a scale of 1 to 10. So high performance at work, we have an increase of 12% when the psychosocial safety climate is strong. So they go from 36 of high performance, 36% of high performing workers to 48% of high performing workers. Again, in the economic climate that we have, not postponing our interventions that we can have in our organizations, organizational interventions, top management commitment, as equally as important as productivity, taking care of mental health. This is both crucial for mental health and for performance at work, and we need both currently. What this means is that leaders can also do something, and this is also something that calls on organizational level interventions, top management commitment, because leaders also report high levels of distress. In fact, line managers in my study were the ones with the highest mean level of psychological distress, way higher than top managers. And this means we need to perhaps train and support managers in our organizations because they themselves have problems with work overload, with their working condition, with mental health issues. So we need to support and train them. And we need to do so because they do have a high impact on these psychosocial risks, which we know a lot about, which are the traditional suspects in terms of mental health. We've been working with these risks for many, many years, and there's a lot of evidence showing that they have an impact on mental health, on absenteeism, and it's still the case during lockdown measures. So we look at social support from supervisor, then there's a 16% decrease in the proportion of people who report high psychological distress. So we decrease distress when the social support from my supervisor is high. Perhaps I can say a quick word about this. Yeah, I still have a bit of time. I want to mention my supervisor at the beginning of lockdown gave me a little quick phone call saying, "Are you okay?" And I was not okay. It was really stressful. We were shocked by the situation. And he simply offered, like, "Do you need anything from at work?" And so we established clearly what the priorities were. He said, "We need to finish the session for the students, finish the term for the students. And that's your only priority right now. Put everything else on the ice and we'll see later." And this to me was really helpful, just knowing what I had to do, where to focus my efforts. And you also said, "You need anything personally, like grocery, anything." And we were getting everything delivered at that time. And there was really long waiting lists for getting your grocery delivered. It would take up to 2 weeks to get it delivered. And he came and delivered $100 of grocery, you know, and I thought, wow, okay, he's got my back. And that made a huge difference. So social support from supervisors, I think we do need to train our managers, but there's also sometimes very simple things that they can do to show that I had your back. And I think for employees, this is what matters the most, just knowing that your boss is there and that they've got your back. Work overload, whenever workload was high, we had much higher levels of psychological distress, of people reporting high levels of psychological distress. Recognition, feeling valued in your organization, feeling that your work is appreciated by your colleagues, by your co-workers, by your supervisors, feeling that you're treated fairly in your organization. This also has a 24% decrease whenever you decrease in psychological distress whenever you feel that you're recognized. And job control also had an impact, perhaps a little bit smaller. So leaders have a strong impact on psychosocial risks, and they need to be perhaps supported and trained on how to intervene on each of these. Now, in French, there are resources for action. My colleagues at the National Institute for Public Health, they have these, I'm not sure if they're in English, I know they are in French, but they have these really nice little help tools, you know, so to act on psychosocial risks. So yeah, we also did another webinar in French last week. It's available on YouTube, but we were going more in depth with what managers can do, and also about managers' own issues and what they have to struggle with, and how some of them are sort of stuck in sandwich between what's expected from them at the top versus from their employees. So the webinar is really available on YouTube. I did look at some resources in English. I think I put something here from the Government of Canada about how to manage psychosocial risk during the COVID-19 crisis, so if this can be helpful. Now, we mentioned the organizational of IGLO, we mentioned the L of leaders, and now we can also look at the G. So what we can do as a group, co-workers. We did show a strong impact of co-worker support. So 14% decrease in the proportion of people with high psychological distress. So feeling, and it also an increase of 10% in high-working, high-performance workers. So also this tells me that despite working from home, despite not being able to be as close as to each other as we used to be, there's still a need for support from my colleagues, and it's still as important in telework as at work. And I want to just say a little quick word about the coffee machine. My co-workers from the School of Psychology, Geneviève Belleville and Manon Truchon, we have a little newsletter that goes among the professors at the university, and they had this little discussion about the coffee machine. And Geneviève was saying, what is sad is that in our accounting view of things, these moments are a waste of time. They will not contribute to any performance index. These moments are worth their weight in gold. I think of several striking words that encouraged me, supported me, made me see another point of view, highlighted that the safety net that exists between me and the cliff. And these words are well spoken. They're all spoken without an agenda, without objectives, around the coffee machine. And this idea that it's perceived as wasteful, well, we're not robots and we have needs even in a professional context. So perhaps these moments around the coffee machine are not lost time. Individually, what we can do, well, yes, it's an individual problem to begin with. So individually, these are the 5 steps to well-being that were done in the UK. There are many, many studies showing support for each of these actions. So connecting with other people, continue to learn, so keep ourselves active cognitively. Invest yourself, so say thank you, you know, but then charity, good charity begins at home. Take time for yourself as well. Being mindful, there's a lot of support for mindfulness, and be active. So there's a lot of support again for physical exercise. And I've always said my conclusions. I will not go over this again, but I do want to finish with a little positive note. In Quebec, the government announced quite a few weeks ago that the tooth fairy was immune to the coronavirus. The tooth fairy being immune, I thought I would read a little message from the fairies. This is 50 wishes for babies. I received that as a gift when my son was born. And so they're all little papers that you can pick from, and you read a little message from the fairy. And I will pick 2. I am the fairy of the ear canal, and I offer you this special little channel which will enable you to listen to those around you with all the attention they will sometimes need. The fairy of the ear canal. And I want to read a second one. I am the tightrope fairy, and I offer you the gift of maintaining balance when all around the world seems upside down. The tightrope fairy. I thank you all for your attention, and I can now take a few questions.
Thank you so much, Caroline, to end on such a positive note. And we're very relieved and happy to hear that the tooth fairy is immune to COVID. And we'll open the floor for questions. So to our attendees, if you have any questions, please input them in the question box. And back to you, Jordan.
Perfect. Caroline, thank you so much. This was one of my first deep dives into some of the thinking around presenteeism, and I learned a lot myself. So I myself have many questions for you, but perhaps that's a separate conversation. But for now, a few questions from our audience today. I think the first one, I think there's 2 that maybe I'll combine. One is, can you just briefly remind us about the different types of presenteeism as you've defined them in your typology, just as a quick refresher, because I think it's important to understand those and take those away. And then somebody had a question about chronic pain in the workplace. And then I guess maybe thinking about where would that typically fall in the context of this presenteeism typology? And have you seen any hinting around what chronic pain might do around presenteeism?
Okay, so in terms of the 4 types of presenteeism, we're suggesting functional and dysfunctional. So these are the 2 most contrasted. Functional being good health, good performance. Dysfunctional being not so good health, not so good performance. And then in the other 2 quadrants, we have overachieving. So you maintain your performance, but it's at the expense of your own health, as opposed to therapeutic, where your performance is not so good, but your health is somewhat good enough. Like you're working perhaps with, I use the image of caregivers, so perhaps you're with a certain level of distress. You have to take care of perhaps a sick child, so you have a certain level of impairment at the perhaps psychological level, and therefore your performance is affected. So you report presenteeism, you report working through illness, but it feels good to do so, and you think it might be good for your health. In terms of chronic pain, originally when we proposed this typology, we had some comments from the reviewers at Human Relations saying, well, how do you apply it to, for example, contagious diseases and all that?
Mm-hmm.
So we're definitely not suggesting that at all costs you should go to work while ill. We're suggesting that there might be different types, and there might be certain situations where it is good and other situations where it is not good to work while ill. And we're trying to sort of disentangle all that. And we decided to, in terms of health, the health axis, to use it only for common health problems, which would include pain, chronic pain, musculoskeletal disorders, stress-related issues, mental health, but perhaps not so much with the idea of contagious problems. Then it might not be applied that well to contagious problems.
Gotcha. So chronic pain from this perspective certainly still fits within that typology, as do many other general health complaints or health conditions. So thank you, that's helpful. I think the other interesting concept here is this aspect of positive presenteeism. And I know that in my head, you talked about the different definitions of presenteeism, and my mind always jumps to the classic North American definition of presenteeism, which is always a negative thing, right? It's always something that we want to be avoiding. Versus you talked a lot about some of the benefits or some of the potential benefits of presenteeism, and subconsciously at the Canadian Mental Health Association, that's very much what we would say as well, is that being at work can be good for your health, and there's a natural drive to it. So I guess that idea that being at work and potentially working when recovering from or living through a health condition, that could be good for your health. You mentioned that it's something that you certainly believe and are advocating for. Is there research to support that notion?
There is research supporting the stay at work option. Yes, there is research showing, there's a lot of research showing that work is good for health, that people who are unemployed are in less good health as opposed to people who are employed. There's a lot of studies showing, for example, that losing your job is terrible for your mental health and physical health. The staying at work option, yes, has been validated in certain studies, but not so much with presenteeism. We've mainly looked at presenteeism as a negative issue. And the paper by my colleagues and myself, I was involved in that initiative by Rule and all with the European School of Thought. We're arguing that we should have a more neutral view to presenteeism because it might not always be negative. And the impact on performance is not systematic. If you think, for example, about musculoskeletal problems, it's something that you have over the long run, and it's likely to have a huge impact on your productivity over the course of 1 year, for example. Whereas a cold, well, it's something that, yes, it will have a huge impact, but on 1 day only. So in terms of, or perhaps 2 days, you might miss 1 or 2 days if you have a cold. So the impact is, yes, quite strong for the cold, but at a short period of time. So this needs to be disentangled, and this is what we're proposing here.
Well, I think it's fantastic, and I think that the shift in thinking about presenteeism, that shift in language, is likely going to take a long time. I know if I were to talk about presenteeism to most employers, and talk about it as a positive, most of them would give me a fairly strange look. And so there's some education to be done, I think, around those positive aspects of working and positive aspects of, as the European model would suggest, working through illness. I think that's a shift that's going to take some considerable time. I think we've got time for about one more question. I know there's many, so I'm just going to try to sort through this. So I guess maybe it's a question that I'll sort of summarize a few. And you mentioned caring organizations, right? And that can fundamentally shift the degree of psychological distress and performance that employees exhibiting presenteeism are experiencing. So I guess my question to you is, in your study, how did you define what makes up a caring organization, and how did you determine which organizations were in fact caring?
Yeah, this was measured with the Psychosocial Safety Climate 4, PSC4, which was published very recently by Maureen Dollard. So it's 4 questions, which are very, very in line with what I showed when I showed management, commitment, it's a priority, we communicate about these issues, and people are able to participate in the organization of prevention. So if you actually look at the little sentences that were below these 4 factors, they're actual items, and that's how we measure psychosocial safety climate. And then we did a median split. We split at the median, looking at people who consider their organization as more caring as opposed to less caring.
Okay, fantastic. Well, again, I think it's right along the lines of the messaging that CMHA provides to all of the companies we work with, is that that climate matters, and the environment that you create is one of the biggest determinants for the health of your employees. So thank you very much. I know we're out of time, so I'm going to hand it back over to Yusra, who will wrap it up for us. So thank you, Caroline, and thank you to everyone that's joined us today.
Caroline, thank you so much for sharing your expertise and insights on presenteeism, psychological health, and workplace performance during the pandemic. We are out of time, but we have collected a few questions. If you don't mind, I can email them to you, and we can post them on our website later on. And Jordan, as always, thank you for wonderfully moderating this webinar. So immediately after the session, you will be directed to the evaluation survey. We greatly appreciate your input on our webinars, as well as suggestions for future topic areas. All of our live webinars are accessible to the public. Thank you again for your participation, and thank you immensely, Caroline and Jordan. Have a wonderful day.
Thank you.